5 complications of spinal arthritis. So, spinal arthritis is a progressive condition. Now, while it may start off mild, if you allow it to progress, it can become severe and then lead to complications, which makes it more difficult to treat, and it also gives us less options. Some of the early symptoms of spinal arthritis are back stiffness, neck pain, or a deep ache that flares up when you move the wrong way or if you make sudden movements. So, in this video, we will discuss the 5 most serious complications of untreated spinal arthritis and what you can do right now to protect your spine. The first complication is chronic debilitating pain. So this first complication is the one most patients already know, and it is a pain that never goes away. What starts as an occasional stiffness after a long day becomes constant. It interrupts your sleep, drains your energy, affects your mood, and slowly shrinks your world. Many of our patients tell us they spend years hoping the pain will resolve on its own. By the time they came in, the structural damage was advanced and far harder to reverse. Early treatment through physical therapy, targeted injections, posture correction, and regenerative therapies can stop the pain from ever reaching this severe level. An X-ray of the spine can also be very helpful in guiding your healthcare provider. The second complication can be nerve compression with symptoms that radiate to the arms or the legs. As spinal arthritis progresses, bone spurs and inflammation begin to crowd the spaces where your nerves exit the spine. This leads to a condition called stenosis, and the symptoms can be numbness, tingling, burning, and weakness that radiates down your arms or your legs. What many patients don't realize is that nerve compression, left untreated, can cause permanent nerve damage. Once a nerve is injured beyond a certain point, it doesn't fully recover even with surgery. So if you start treatment early, you can alleviate some of that pressure off the nerves and give it the best chance of healing. If you do not treat it early and you develop complications, you may have residual symptoms that will stick with you for the rest of your life, even if you do therapy and take the appropriate medication. In terms of supplementation, a lot of times when people have nerve damage due to possibly a disc bulge, vitamin B complex is given to protect the nerve and to help it to recover. The third complication can be spinal cord compression. This is a serious complication. This is the most serious complication of all, and the one we all want every patient to avoid. Severe spinal arthritis can compress the spinal cord itself, a condition called myelopathy. The warning signs include difficulty walking, loss of fine motor control in your hands, balance problems, and in the most urgent cases, loss of bowel or bladder control. Now, there is a condition called quarter equina syndrome. That is where the disc bulges into the spinal canal and compresses the quarter equina. This is a neurosurgical emergency. Persons would experience numbness between the legs and possible loss of bowel or bladder control. If you are experiencing this, then you need to get to the accident and emergency as quickly as possible, so neurosurgical intervention can possibly be done. Spinal cord compression is not something that gets better on its own. Without treatment, it can progress to permanent paralysis. This is the complication that turns an active, independent person into someone who can no longer walk unassisted. If you're experiencing any of these symptoms, please don't wait, seek evaluation immediately. The fourth complication would be postural deformity and loss of mobility. As the discs and the joints of the spine deteriorate, your posture begins to change. You may notice a forward slouch, a stiff neck that won't turn fully, or a loss of your natural lower back curve. Simple movements such as bending to tie your shoes, looking over your shoulder while driving, or reaching overhead can become difficult or impossible. So sometimes we see patients who are unable to do this head movement. They don't have that range of motion. A lot of them would actually just stop there and there. So they don't have this full range of movement in the picture of severe neck arthritis. Once postural deformity sets in, places abnormal stress on the rest of the spine, accelerating damage elsewhere. Treatment becomes more complex and reversal becomes far less likely. Early care preserves your natural alignment, your flexibility, and your ability to move freely throughout daily life. The fifth complication is the need for spinal surgery. By the time many patients reach a spine surgeon, conservative options have been exhausted, and the only remaining solution would involve spinal surgery. Spinal surgeries do carry their own risks. These are serious procedures with possibly months of recovery. So at the end of the day, in order to prevent these complications or to minimize the effects when they do occur, it is to take action early. You need to engage in spinal care, and this would come through weight loss, physiotherapy, exercises, stretches. So if you're noticing stiffness, recurring pain, numbness, or any change in how your back or neck moves, even if it seems minor, don't dismiss it. If you would like to schedule a consultation, you can call or WhatsApp 747-5297-308-3370. We are Progressive Health Services at number 4 Chincuna Gardens in Chincuna Road, Cunupia.